Hello, I'm Dr. John Andrews with the University of California, San Francisco, Department of Neurological Surgery and Benioff Children's Hospital, and I'll be presenting the case of a baby girl delivered at term with global hypotonia. An MRI of her brain and spine showed a intramedullary enhancing lesion extending from her medulla down to her upper thoracic cord, concerning for a high-grade spinal neoplasm. On exam, the patient was awake and alert with a flat fontanelle and global hypotonia. Over the next days to weeks, her symptoms continued to worsen. At that point, she was taken to the operating room for cervical decompression and a biopsy guided by electrostimulation and ultrasound. Pathology showed a spinal cord glioblastoma, WHO grade 4. Next-generation sequencing of this biopsy found a neurotrophin tropomyosin receptor kinase 1, or NTRK1, gene fusion. Now, histologically, her sample showed diffuse staining for the protein gene product of NTRK1 called tropomyosin receptor kinase, or TRK. The patient was started on induction chemotherapy with etoposide and carboplatin with minimal response. 2 weeks later, she was started on a TRK-specific inhibitor, larotrectinib, and 2 weeks after that began to show improvement in symptoms and radiologic response of her lesion. 8 weeks after starting the TRK-specific inhibitor, she showed no longer any MRI detectable lesion as seen in the figure. 17 months after starting this therapy, she continues only on the TRK inhibitor and is crawling and progressing towards walking. Clinical trials of TRK inhibitors in both adult and pediatric cancers have shown promising results. Now, this is an example of a next-generation sequencing guided treatment in an otherwise very aggressive pediatric tumor. Thank you for your time and attention.